A hearty good afternoon and welcome to our session on recurrent pregnancy loss. We are glad to have Dr. Anuranjita Pallavi, fertility from Navi Mumbai, with us today to help us understand the topic in detail. Doctor, you have the stage.
Thank you so much. Hi, I'm Dr. Anuranjita Pallavi, consultant at Apollo Fertility, Navi Mumbai. First and foremost, I would love to wish you all a very happy Navratri. And coming back to the basic topic, which I'm going to talk about, it is on recurrent pregnancy loss. Actually, I've selected this topic because I'm getting a lot of patients in OPD who are coming up with the same thing of recurrent pregnancy loss. Like, I have like 3 to 4 patients coming like in a month who come with the same complaint. So I thought might as well just give an overview about recurrent pregnancy loss. So coming to the causes of recurrent pregnancy loss, how do we divide recurrent pregnancy loss? Recurrent pregnancy loss can be in the first trimester. First trimester, what I mean is by 12 weeks of gestation or the first 3 months of pregnancy. It can also occur in the second trimester, and it can also occur in the third trimester. However, the causes of recurrent pregnancy loss in each trimester is totally different. Sometimes it can overlap, but yes, most of the time it is different. So, coming to the causes of recurrent pregnancy loss, mainly in the first trimester, because that is the maximum number of patients which I see in OPD come with the similar complaints of losing their pregnancy in the first 3 months. So, coming to the causes of what are the causes of recurrent pregnancy loss? Now, the first and the foremost cause of recurrent pregnancy loss is genetics. What do I mean by genetics? Is it is chromosomal. Genes are nothing but the genetic material by which we all are made of. The individual or the couple might be normal, but then when the genes are transferred to the baby or to the embryo becomes abnormal, leading to recurrent pregnancy loss. So this is the most common cause of recurrent pregnancy loss in the first trimester, accounting to about 50% of all the cases which we are seeing in OPD. So you can see how important it is to rule out any genetic component in a patient who comes with recurrent pregnancy loss in the first trimester. Now, what are the facilities which we have, to find out whether it is because of genetics or not? Now, the first test which we advise to the couple if we are suspecting a genetic cause is chromosomal analysis. I mean, the karyotyping of both the husband and the wife. And if possible, in the past, if they have gotten any karyotyping done of the fetal tissue. So if they have the report, so first is the karyotyping of both the couple as a whole, and if we find any genetic defect or the chromosomal defect in either the husband or the wife, we can offer them something known as a PGS or a pre-implantation genetic screening, which is like the upcoming thing. In what we do is before implantation, we send the biopsy of the embryo and we find out whether recurrent pregnancy loss it is PGTA. What we do, so in those cases, we find out what is the cause and which embryo is normal and which embryo is abnormal. Suppose we have 10 embryos and we have sent the biopsies of all the embryos, and we find that okay, embryo 2 and 3 are normal and rest are abnormal. So what we do is go ahead with the transfer of only those embryos which have, been found to be normal. Because as I told you, genetics play a very important role in the first trimester abortions. So yes, we are living in 21st century, and the facility which we offer is the PGS screening in such patients who we have done the test, we have found out in karyotyping that the genetic issue is there. So in those cases, we go ahead with pre-implantation genetic screening or PGS. Now, coming to the second most common cause of recurrent pregnancy loss is something known as a APLA. APLA is nothing but anti-phospholipid antibody syndrome, where your own body uh, recognizes the fetal tissue as foreign and tries to destroy it, leading to abortions. in these cases, we have again autoimmune diseases also. One is APLA, antiphospholipid antibody syndrome. We have blood tests to diagnose these conditions. And if the patient has been confirmed to have APLA, or if they have any other autoimmune disease, the treatment remains as blood thinners. We immediately, the moment the patient conceives, we start them on blood thinners. We give them extra progesteronic support. And if it is another or any other, like ANA positivity or any other autoimmune disease, in those cases we prefer to start them on steroids also, so that we are suppressing the basic immune response of the body, and helping the embryo grow, and not allowing the antibodies of the self antibodies to destroy the embryos. Now, the third common cause of recurrent pregnancy loss in the first trimester, these are all the reasons which I'm telling in the first trimester, that is the first 3 months of pregnancy. Now, the third cause is infections. There are TORCH group of infections. There are a group of viral infections like toxoplasma, cytomegalovirus, and then we have rubella. Then we have herpes simplex. All these form a group of infections which are called as the TORCH group of infections. And these are also known to cause recurrent pregnancy loss and also abnormalities in the children. So again, the screening is available. It is a blood test where we screen the antibodies to this TORCH group of infections. There's a TORCH panel where we screen the patient and give the treatment accordingly, whether it is. And one thing which I would like to say is, if the patient is IgG positive for all these infections, please do not start them on any treatment, because IgG represents a long term, long lost infections of the past. It does not indicate that the patient is suffering from any active infection. So if the TORCH group of infections, if we plan to screen the patient and if we get IgM positivity, then only we should go ahead with the treatment in those cases. Now, these are the three important causes of recurrent pregnancy loss in the first trimester. First was the genetics, second was the APLA, the autoimmune disease, and the third was the TORCH group of infections, which are known to cause abortions in the first trimester. Now, the other causes include the hormonal causes like diabetes, which is an undiagnosed diabetes can lead to abortion, or thyroid can lead to recurrent pregnancy losses. High levels of progesterone can lead to recurrent pregnancy losses. So hormonal analysis also should be done in these patients, and accordingly, if the thyroid is high or hypo or hyperthyroid, then the treatment is given accordingly. And if it is diabetes, then the control of the sugars, and the planning should be done only when the sugars are controlled, and when the HbA1c, that is one test which tells us about the sugar control over a period of 3 months. So when the HbA1c is around 6, then only we ask the couple to go ahead with the planning of pregnancy if they're planning it naturally. So these are some of the causes of recurrent pregnancy losses in the first trimester. And then again, the uterine factors need not be ruled out. Whether there is a, for example, if there is a septum, septum means this is the uterus and there's a partition here. So if there is a septum, then that septum has to be removed. If the fibroid is the cord, then fibroid has to be removed. So uterine factors also need to be considered in a case of recurrent pregnancy loss, because these are also known to cause recurrent pregnancy losses. So one is the genetics, for which we do the karyotyping, and if we find any abnormality, IVF, plain IVF should not be offered to the patient who's coming with complaints of recurrent pregnancy loss of genetic etiology. Why is because anyways the patient is getting pregnant. So by doing simple IVF, we are not giving any benefit to them treatment wise. So it should always be coupled with PGS in these patients. So genetics, infections, hormonal, uterine, and APLA syndrome. These are the 5 causes, usual causes which can cause recurrent pregnancy losses in the first trimester. Coming to the second trimester, hormones still play a role, and the second trimester is generally cervical incompetence, where as the baby grows inside the womb, the cervix actually is weak, due to which the cervix, or the mouth of the uterus, what we call it, opens up, and the embryo is, and the baby is, fetus is pushed out. So this is called a cervical incompetence. And in those cases, what we do is a cervical stitch. We take it in the next pregnancy, where we do it at least 1 to 2 weeks prior to the expected loss which had happened in the previous pregnancy. Third trimester, again, the issues, hormonal issues are the main common cause, and the other pregnancy related issues can also lead to recurrent miscarriages. But then, most important here, the point of discussion I wanted to highlight was the first trimester, the genetic component, the APLA component, basically the genetics here, because I come from the IVF background. So basically the genetic component, and what we offer in those patients is a PGS, that is the pre-implantation genetic screening, where we screen the patient, sorry, not the patient, the embryos, and we only transfer a healthy embryo inside the womb. So this was just an overview about recurrent pregnancy loss. How do we manage it? And if any queries, you can always get back to me at Apollo Fertility, Navi Mumbai. Thank you so much. Have a nice day.